These are pretty juicy, so I hope you're ready.
Bring it on. Wow, we're going to really hit the ground running this morning with this super hot topic.
Hello, my name is Morgan with Bonafide Health, and this is our first episode of our new YouTube series where we are going to be reading Reddit stories about menopause. And I'm here with Dr. Dweck, our Chief Medical Officer, and she's going to go ahead and intro herself.
Good morning, and good morning, Morgan. I'm so excited to be here because I have previewed some of these questions, and they are great hot topics. My name is Dr. Alyssa Dweck. I am a board-certified OBGYN. I've been in practice for more than 20 years, and I also am the Chief Medical Officer at Bonafide.
We're so excited to get into these stories, so we are just going to go ahead and hop right into it. These are pretty juicy, so I hope you're ready.
Bring it on.
All right, so the first question is, why aren't we louder about clitoral atrophy? And here's this Reddit story. It's pretty interesting. The sudden inability to orgasm was the thing that alerted me that something was very wrong. Once I started digging into what could actually be happening, I realized I hadn't been dying for the last 8 years. I was just losing my hormones. I did go to the gynecologist once the inability to orgasm started, and she offered to give me some birth control pills. Every symptom I told her about indicated that my hormones were at the bottom of the barrel, and I was offered birth control pills. Completely glossed over the problems with bladder and urethra. I now know that it's all related for many of us. I ended up using telehealth to find someone who would prescribe me something that would actually help me. Within 3 days of starting the systemic HRT, my bladder was improving. It took quite a while for the ability to orgasm to improve. It's better, but still nothing like it used to be. I had never heard of this until it happened to me. I'm a fairly intelligent person, and I feel absolutely blindsided by the lack of knowledge about menopause and hormone loss. I thought I would get some hot flashes and my period would stop. I never imagined losing pleasure would be part of it.
Wow, we're going to really hit the ground running this morning with this super hot topic. I don't know too much about this person who's stating this story, but I would imagine that she is either perimenopausal in those years leading up to menopause or menopausal, where it's been a full year without menstruation. And what's really going on here is decreased estrogen production. In other words, the ovaries are not making much estrogen at all. Low estrogen has a very specific effect in the vulva, which is all the external organs in the genital area for women, and in the vagina, which is the inside portion, the inside canal. What happens with lower estrogen is we see lower blood flow, and lower blood flow leads to less natural lubrication. And as this goes on without any attention to it, we will see that the tissue becomes super thin, inelastic, prone to injury, more sensitive to discomfort, and less sensitive to sexual arousal or sexual stimulation. So we have to do something to help with correcting this. In the usual course, the first order of business is education. This is a perfectly natural situation that's occurring, and so educating people and normalizing the situation can be very helpful because, after all, people get nervous and scared when they see a symptom of this nature. Second, we recommend regular vaginal or vulva moisturizers. This will help to keep the tissue really elastic, less prone to injury, and more inclined to respond to the typical sexual stimuli, if you will. I usually recommend vaginal or local estrogen in the form of a cream to the vulva for issues such as this, because that really can help to repair the tissue and also enhance the blood flow so that this situation gets reversed.
Yeah, when I was fielding these stories, I was actually sitting down with my little sister, and obviously, we're both in our 20s, and we were kind of talking about how we don't know anything about menopause and how much of a real effect it really has on your life when it starts to happen. And I was fielding these stories, and I read this one to my sister, and she was like, clitoral atrophy, like my clitoris is going to come off. And I was like, well, I don't know about that. But I think it's really interesting that, we in our field of, talking about menopause all the time, we talk about atrophy pretty often. And even with me working in this job at this company, I didn't realize that it also affects like more external than just like your vagina itself. It's the surrounding areas as well. And that's really interesting. And a lot of the women in this thread were kind of talking about how they had no idea that this was going to happen to them. And it can be really scary. And like you said, there's really not much education. We don't talk about it very openly. Right. And younger women in our 20s, we have no idea about this. We're like, oh, well, I guess our periods will stop and then we'll have a hot flash and we might sweat through our clothes sometimes. But we don't realize that there are so many other subsequent effects.
Sure. Well, I always say, don't forget about the vulva, which again is everything external, because we often speak only about the vagina, but the vulva is so important and very much involved when there are effects due to low estrogen. I also want to make note about general clitoral anatomy. So we often think that the clitoris is just that knob or nubbin of tissue that we see externally, but really the clitoris is unbelievable because it actually extends with what we call crura or legs. The clitoris extends into the vulva along the labia. And so there's a lot of internal stuff going on that we're not necessarily aware of just for visualization. The only way to really diagnose clitoral atrophy in the medical setting is with a physical exam. So I think it's really important to visit your gynecologist, let them check things out and make sure that's really all that's going on. But this is not an unusual physiologic response to low estrogen, and it can absolutely be managed.
There's some education for you. Your clitoris has legs. So just so you know, FYI. Some of these comments are like, I agree, it's completely devastating. The sudden inability to orgasm was the thing that alerted me something was very wrong. This commenter says, you kidding? Men have to web-to-door websites that evaluate, prescribe, and then send discrete packages of pills and creams and shampoo. There is no Louisiana suing New York to eradicate a doctor for writing a virtual prescription when it's ED pills or stuff like that. And I think that's really interesting is that these things are accessible for men when they have erectile dysfunction, but it's not as accessible for women. And I think that, this is something we talk about a lot in our area too, is like men are able to get these things so easily, and it's a lot harder for women to get access to care for this.
Well, let's talk about a couple of things there because that's a really loaded and interesting statement. First of all, the clitoris has erectile tissue just like the penis does. And so this is where blood flow becomes so important. How can women on their own help to promote and enhance and sustain good blood flow to the clitoral area even during menopause? Well, of course, using a good moisturizer or even vaginal or vulva estrogen cream. Number 2 would be to hydrate well. And number 3, believe it or not, would be using something to really stimulate the tissue, whether it's a vibrator or self-stimulation. These things are very important to help promote blood flow and keep it there during the menopausal state. So ladies, take control of the situation and help to enhance the blood flow of the vulva.
I had no idea that. Is it basically the same mechanism then?
Yes, it is. So what happens is that blood flow is enhanced through a situation where blood vessels in the genital area dilate. And with vasodilation or dilation of blood vessels comes this big rush of blood.
I had no idea. That's crazy. So this woman says, fully in menopause now, and I hate kissing. So this Reddit user says, just curious. I've heard others complain about zero interest in sex. Definitely have that issue. Poor husband. Kissing now just completely grosses me out, and hubby kisses a lot. His dental health is excellent. He takes great care of his teeth and gums. It's just gross. It's so surprising how much my personality has changed since menopause arrived. I'm not snuggly where I used to hold hands, sit next to, hug, touch all the time. Now, no thanks. Please give me space. I've talked to hubby about how I've changed since, and he understands, but I do miss how I was in that way. I do like now how I feel way more independent and give less craps about what others think. I was a people pleaser for sure before. Anyway, I was just wondering if anyone else is grossed out by certain things now.
Well, this is also a loaded question and likely full of complexities. So when it comes to any sexual function, including just kissing, there is a biopsychosocial input to the situation. And what I mean by that is some of this may be physiologic or biologic, where hormones have changed. So the actual thought of any sexual activity may be altered. There's also psychological factors at play here. So Perhaps there's some sort of relationship nuance that is either occult or known that might be causing this issue. And then there's just the general social stressors that are going on in people's lives, especially with aging and menopause. So for women, as an example, women are dealing with stresses of work, with kids, with older parents, with changing body shapes and sizes, with physical discomforts of menopause. So these things all have to be taken into account, and I would suggest a good conversation with this person's partner so that it can be elucidated further.
Yeah, communication is really important. And I think especially during menopause, obviously I haven't gone through menopause, but working here and hearing women's stories all the time, I think communication can go so much farther than people think. And it really is so important, especially during a time when everything is really changing for you.
There's one other thing to mention. Men can't read women's minds. Even in couples that have been married for a very long time or have been cohabitating or together for a very long time. So sometimes it takes a very direct conversation to really elucidate what's going on. Yeah. And that may really be helpful.
Absolutely. This is a really interesting comment on this post. I have a long-term boyfriend of 8 years, and I've been thinking about ending it for a multitude of reasons, but menopause is actually making it an easier decision to make. Thankfully, after a breakup a few years ago, I moved out and bought my own house. When we got back together 2 years ago, I never moved back in with him because I love my sweet little house that's filled with cats and a dog and all my belongings. Don't have to deal with him remaking the bed after I make it because it wasn't right. Sorry, I didn't mean to digress. I have zero interest in being affectionate, having sex, or spending time with him. After writing this out, I realized that I need to end it because I'm not on the fence anymore.
I would venture to guess that this is not all due to menopause, okay? So while hormones have something to do with the day-to-day physical and emotional feelings that people are experiencing, this sounds more like a relationship issue, and maybe menopause did you a big favor.
Maybe it did. I hear this a lot, though, in these comments, like even spending time with not even just your romantic partner, but people in general. Do you think that there's anything that's actually related to menopause itself that makes women maybe want to isolate more during menopause?
Well, there certainly could be. And again, I'm not a mental health specialist, but I would say the following things would be contributory. Number one, many women in menopause are physically very uncomfortable. They're having hot sweats during the day, which can interfere with their day-to-day activities. Those symptoms are manageable. So if you're feeling physically more comfortable, you may have more tolerance to deal with relationships that are external. Number two, sleep. Sleep is often really interrupted and disrupted both in duration and quality when it comes to the menopausal time. Some of this is due to the busy mind, where women wake up a lot in the middle of the night, can't get back to sleep because they've got a lot of things on their minds, and this can be addressed. Some sleep disruption is due to hot flashes and night sweats that are occurring during the nighttime. And keep in mind, when any of us are lacking in sleep, we just have so little tolerance to deal with even the smallest stressors during the day. So this is something that can be managed. I think also women who are aging are really trying to, they have found a comfortable space, if you will, with themselves from time to time. So it's really important to create some time where you can really promote self-care and do activities that are important to them. Finally, I would say that stress has a lot to do with this as well. Yeah. We mentioned before that women of the perimenopause and menopause age have so much stress, whether it's with jobs, financial responsibilities, professional responsibilities, kids. The aging parent one is really big now. Yeah. Stress can absolutely interfere with people's tolerance for other people being around. I would say focus on lifestyle habits, focus on sleep hygiene, focus on a good, healthful diet, exercise, which is very helpful, especially to let off steam, and then allowing for some self-care time.
And I mean, I think the stress one is such a big one. Another thing that I feel like we don't talk about a lot is the context of what's happening in your life, typically around that age between, a lot of these women here are saying, they're starting at 45, close to 50. Usually the kids are going off to college at that point. You have other factors that can exacerbate these symptoms that are happening because of menopause. But then, you're also in this other transitional phase of your life where the kids are leaving and now it's just like maybe you and your partner, and you're trying to kind of reestablish what that relationship is like without your kids in the picture or when things are changing. And that's scary.
You are so right. I mean, look, there is a saying called the empty nest syndrome for a reason. So although you may be extraordinarily excited for your kids to get off and start spreading their wings and being on their own, it comes with a lot of changes to your day-to-day routine, particularly the way you feel about your caregiving as maybe a mom. The second thing is that hormones are changing and certain neurotransmitter levels are changing. So, for example, estrogen and also serotonin change during the perimenopausal and menopause transition. And this has biologic and physiologic effects on the way people's moods are.
Yeah. I didn't know your serotonin changes too.
It does. Estrogen and serotonin are intricately involved with each other.
I had no idea about that. That's crazy. This third story is kind of related back to the first one about atrophy, but I think this is a really important one to talk about. This user said, I just learned from TikTok and then the internet and then an RN that natural-born women lose their labia minora through menopause. What? I'm not a doctor or a nurse or anything like that, but I'm a menopausal woman who was clearly not taught enough about my body. Does American Girl make a body book for Nana? Let me know.
Well, they may now that they've heard that. Look, I think, and I don't mean to make light of this question at all, but your labia are not going to fall off one day when you're in menopause. So let's just get that clear. But what does happen is there is shrinkage of the tissue because of loss of estrogen. Also, we see loss of collagen, which is, of course, a big piece of the integrity and structure of skin and external tissue, soft tissue. Using exogenous estrogen cream may be helpful. Hydrating well may be helpful. Using a really good moisturizer with an ingredient like hyaluronic acid, which of course we're all familiar with because of moisturizers for our face, could be very helpful. But your labia are not going anywhere. They just may be flattening out a little bit as a result of low estrogen.
And I do want to ask this because I think the people at home might not know. Is there a difference between like a vaginal moisturizer and a lubricant?
I love this question because, in fact, there's a big difference. In gynecology world, we think of a moisturizer as something that is used regularly. So this is something that will help to restore moisture, and it's used chronically, like 2 or 3 times a week, or in the case of face cream, for example, maybe every day. And this can be used to maintain moisture over time. We consider lubricants to be more of an on-demand product, so used when needed. Typically, a vaginal lubricant is used during intimacy, not only to help reduce friction and eliminate dryness at the time of an intimate act, but also to enhance pleasure. So moisturizers used more chronically, lubricants used more on demand. There is quite a bit of overlap, of course, but I think that's the main difference.
Maybe moisturizers to help you retain that moisture over time, as opposed to lubricants are just something that you use when you need it.
Yeah, and of course, it all depends on ingredients. So, we often talk about moisturizers for the vagina that contain hyaluronic acid. Mm-hmm. In general, hyaluronic acid is something that our bodies make naturally. But with age, and so naturally with menopause, we do get a big decline in the amount of hyaluronic acid that we produce. So using it in the form of a vaginal moisturizer can be quite helpful because hyaluronic acid as an ingredient can hold on to maybe 1,000 times its weight in water. And that will have longer lasting effects. Some moisturizers also will contain something that's maybe more oil-based, like sweet almond oil or coconut oil or something of that nature, that sort of seals in the moisture because this is a barrier, if you will.
Okay, interesting. All right, moving on to the next story. This one kind of made me mad when I read it, so get ready.
I'm ready.
My husband just proposed abstinence until after menopause. I'm 31. My husband is 36. We've been married for 7 years. I've stood by this man through a lot of turmoil. A massive custody battle over his oldest daughter upended our life for years and caused a tremendous amount of stress. His mother's emotional abuse, his complete lack of emotional regulation. So lots of relationship issues going on in this one. My IUD is expiring and I don't want to continue relying on an IUD. My OBG says she's delivered babies born in spite of this exact IUD, and she never delivered a baby born in spite of sterilization. I can't afford another child financially, and I work so much to support the family that I can't raise another child. I can't be up at all hours of the night nursing a baby. I'm not getting sleep while shouldering the weight of being the primary income. People are getting laid off at work left and right. Somehow I've managed to keep my job, but I can't risk getting pregnant right now. My husband flat out refuses a vasectomy. He is 1,000% convinced that it will give him prostate cancer. His dad died of prostate cancer and had a vasectomy when he was younger, so it's irrefutable proof now in his mind. So I'm having my tubes removed in a week. I'm using my PTO for the year for this surgery, but my coworkers all think I'm going on vacation. I'm too embarrassed to say what I'm actually doing and deal with the why doesn't he just get snipped questions, because the answer is that I don't have a husband who cares enough about me to do that for us. I put so much work into trying to help him open up sexually and unleash any inner beast, but he's really just uninterested. If he gets off and I don't, never in 1,000 years would he finish me off. Fingers, toys, oral, or just nope. So I feel like I have all the financial weight, constant daily compromises that come with being in a partnership, and the sacrifice of freedom and personal interest and firefighting having any of my needs met. And in return, I get sex that lasts no more than 2 minutes and a couple of times a year. So my option is surgery or no sex, which is literally the primary difference between being roommates and being married. This man has only ever benefited financially from being married to me, but he's proposing that I literally get nothing in return as a serious solution. Not that he step up, that I lower my standards even more and just completely let go of my physical needs in addition to having already given up on emotional needs. That's his proposed solution.
Wow, there is a lot to unpack here. Again, I think a couples therapist could be quite helpful to work through some of these really lingering issues that sound like they've been going on. But as a gynecologist, let's talk about some of the ins and outs of some of the contraceptive issues that are at hand. First of all, reasons for having a tubal removal or tubal ligation are plentiful. It is an extraordinarily successful and efficacious way to prevent pregnancy. So that's a good thing. Number two, there is an added benefit to having your tubes taken out, which is a significant reduction in ovarian cancer risk and tubal cancer risk. So maybe that would be another enticing factor to go forward with this. Number three, it is a one and done, pretty simple procedure when done in experienced hands. Of course, any surgery could have side effects, including those from anesthesia. So it is a very individual decision. I think most of the issues here really stem more from relationship issues rather than the concern about having a tubal ligation. The thought that vasectomy causes prostate cancer has been controversial for years, but there's so much else that goes into a man deciding whether to have a vasectomy or not, and a lot of it is cultural and based on values that a person may have been brought up with. Again, a really good topic for a therapist to unpack. If you've been happy with an IUD in past and it didn't cause any side effects for you, feel free to continue with that until you feel that you can make a commitment towards a surgical procedure. Again, there's, I think, a lot more to this story than just the thought of what birth control to use.
Definitely. There's lots surrounding this issue. It seems like they have their own, interpersonal relationship problems that definitely need therapy. My question about this, I think, is I've heard that vasectomies can be reversed. Can tubal ligations be reversed also?
Yeah, that's a really good question. So vasectomies can be reversed, not always successfully, but they can be. Also, vasectomies are an office procedure, typically done under local anesthesia and very well tolerated. As far as tubal ligation, in these current times, we normally recommend not doing a tubal ligation, which is just basically cutting off the connection of the fallopian tubes by removing a small segment or cauterizing a small segment of the tubes, but rather to remove the entire tube on both sides. And the reason for this is due to the incredible decreased risk of ovarian and tubal cancers. So it is a non-reversible procedure if you have your tubes removed. Okay. It is possible to have tubes reattached with the former just tubal ligation, but it's not always successful. And these days with IVF available, most of the time couples will go to, or people will go towards having IVF rather than a tubal reversal because the success rates of future pregnancy are much better.
Okay, this next story comes from AITA. If you know it, you know it. This one says, AITA for telling my dad what my mom did with a pie at the grocery store.
Oh, boy. I'm wondering how this has to do with gynecology, so give it to me.
Don't worry, we'll get there. I, female 18, can't believe I'm writing this right now, but it just happened and now I feel utterly terrible about it. My mom, 54 female, and I went to run some errands today. My mom and I are super close and I love her to pieces, so of course I was going to go with her. We got to Vaughn's and my mom was looking for pound cake and her purse hit a pie and knocked it off the shelf. Now here's where the big situation that my mom is beyond mad at me occurred. The pie hit the ground and fell out of its container onto the floor. My mom waited for this man to exit and then grabbed the pie and put it back in its container, back on the shelf, and just left it there. I told her she had to go tell someone because when they drop stuff on the ground at the bakery, they automatically throw it away. My mom gets mad at me and tells me to leave it alone. I told her no, go get someone or at least buy it because you can't just do that and put the pie back. My mom gets even madder and tells me to get over it and shut up. Anyway, we got home and my mom left for a walk with the dog and I told my dad what happened. My dad got mad and told my mom what she did was wrong and she should have at least bought it, especially because there were freaking cameras. I wasn't there when my dad and her talked about it, but my mom texted me saying, and I quote, "Really, this stupid thing you told Poppy. Go tell him that you used pot and drank in Europe or that you're not a virgin. Come and tell him." AITA for telling my dad what she did because she is extremely mad at me and I've never seen her like this.
Okay, so here's the gyno connection. I am guessing, based on this young woman's age and her mom's likely age, that perimenopause has reared its head. And what is going on during perimenopause? Well, first, a little definition. Perimenopause are the years of time, it can last 2 to even 10 years, where hormones like estrogen, progesterone, and whatnot are really volatile. And this can have a very significant impact on mood. In fact, I see patients in my office all the time that come in and tell me they feel like Dr. Jekyll and Mr. Hyde because their mood changes on a dime. Mm-hmm. And they often find themselves with behaviors that are unrecognizable. So my guess is that this poor mom knocked the pie off the shelf perfectly by accident and had a little lapse in reason, maybe because of some hormone imbalances due to perimenopause, and put that pie back without thinking of repercussions. Again, I am not a mental health specialist, but this seems like a perimenopause situation to me.
So the reason that I chose this story is because diving into the comments, everyone was saying, your mom's probably going through or about to go through menopause.
Yeah.
And she later did an update, and I won't read the whole thing because it's very long, but she basically sat down with her mom and she said that she's been having brain fog and she's been getting a little bit confused and she was embarrassed. Yeah. So it sounds like the culprit might have been a little bit of a hormonal imbalance. But when I read that one, I was like, what did this lady do with a pie? Luckily, she just put it back on the shelf. But I was thinking it might have been something worse.
Well, I will say this. My patients get a little nervous when perimenopausal symptoms of this nature come up because they wonder if they're going crazy. Mm-hmm. And I think that it is reasonable, if strange things are going on over and over again, to look into some medical conditions with blood work or imaging or just a good history. But typically, this mood change, including irritability and having very little patience, or just not making the same or having the same capacity for decision making in the moment, can be due to perimenopause. I want to talk about something you brought up called brain fog, which is extremely common during perimenopause and beyond, to be honest, but most people complain of it during this time. And this is sort of a conglomeration of symptoms of executive function that get a little bit off during the years of perimenopause. Part of this is definitely hormonal. Part of it is due to sleep disruption and poor quality of sleep, because we all know when we don't get enough sleep, we're kind of foggy and somnolent during the day. Part of this could be dietary in nature, because if somebody is having high sugar or a lot of ultra-processed foods or maybe really large meals, this can have a real impact on glucose or sugar metabolism and can cause some changes with mood. In addition, women, hydration status matters. So hydration is really important at this time, especially if people are having a lot of hot flashes and night sweats, at which time people can perspire and become dehydrated. So that's a long-winded way of saying, I have a feeling this is perimenopausal in nature, and all of these symptoms are likely due to some brain fog and hormone changes.
We talk about brain fog a lot, and it sounds almost like a vague term in a way. Is it something that's fully understood, or are there still a lot of question marks about what causes it and what it really is?
Well, you are exactly right on the pulse with this because, number one, it is not fully understood. But we do know some associated factors include sleep, include nutrition, include hormone status, and also stress. So these are always these lifestyle things that we try to get a handle on early to help prevent brain fog from being an issue. We also know that people get scared that they have something much more serious wrong, whether it's the beginnings of dementia or Alzheimer's or, God forbid, a brain tumor or something that could be occurring centrally that really is problematic. This is why I say we often get a really, really good history about the symptoms of brain fog. We do a physical exam, we do blood work, we might do some imaging, more to rule everything out so we can blame these vague symptoms on perimenopause or hormone changes and provide reassurance for people.
Would you say that brain fog is related to, can it have cognitive effects as well? Or is it more in that executive center and decision making?
It's any and all. So decision making, memory, focus, those are all part of the brain fog conglomeration of symptoms. And people do notice difficulty with decision making. They almost feel like they have an adult form of ADHD or ADD, and that's something that also can be checked into. We also look carefully at medications people may be taking. We definitely look for signs of depression or anxiety, which can absolutely cause some of these symptoms. So it is multifactorial, getting more understood over time, but still with many questions.
Yeah, so it sounds like, keep up with your diet, keep up with your sleep and hydration as much as possible, and try to mitigate those other external factors. And then you can kind of deal with, if it has to do with your estrogen decline or other menopausal effects, you can deal with that. But
I do want to make one thing really clear. We know that people on hormone therapy may notice some improvements in their cognitive function or brain fog, but hormone therapy is absolutely not recommended as a first-line treatment for these symptoms in and of themselves. One thing we do recommend for women who are really dealing with brain fog symptoms would be to do mental exercises, whether that's in the form of reading or learning a new language or listening to music or doing puzzles or engaging in community and, activities that really prompt a lot of conversation and thinking. So basically exercising the mind.
Yeah, I think that's so interesting that a lot of these things can be at least mitigated by lifestyle changes.
Yeah.
And I think that's really important for women in this age category as well, is just, your life is changing. Like we talked about earlier, the kids are leaving, your sense of purpose is probably shifting a little bit. And maybe this is a good time to look at your life and reevaluate where you want your priorities to be.
Sure.
And focus them on yourself, because you are going through a lot of changes at once. So this next one is why we evolved to have menopause. And this is a really interesting one because actually, I thought that all mammals went through menopause. It seems like that would be the normal thing, but actually only 3 animals, including us, go through menopause, and they're killer whales, short-finned pilot whales, and humans, which is very interesting. Can you kind of dive into that a little bit and explain why that might be?
Yeah, this is very interesting. And I would say that I don't know what else we have in common as humans with these whale species, but I will say this. There is a theory out there called the grandmother hypothesis, which essentially tries to explain why do humans have menopause in the first place. And most of the thinking, and I'm not an expert on this, but most of the thinking is that women go through menopause so that their reproductive capabilities go away in an effort so that women can help their daughters with their offspring and not get distracted with their own offspring. And the purpose of this is that the daughters can then go ahead and have more children and basically keep the species going, if you will. It's also thought that this evolved to promote longevity. So there is a good plausible evolutionary theory for women going through menopause.
That's so interesting. And, I personally love killer whales. I know a lot about them. I wrote a book about them. And they have very intricate emotional relationships within their pods. And what I've learned in doing my research about killer whales is that they're matriarchal societies. The groups are run by the oldest female in the group, and she teaches the other younger females how to hunt, where to find mates. So it's really interesting, and they actually have very similar life stages to us. So orcas also go through menopause around between the ages of 40 and 50, and they live to be 80 to 90, some of them over 100 years old. And they spend the rest of those years teaching the pod how to be and how to exist, and they develop the culture of the pod, which is really interesting. And I think that's just such a neat thing for us to share with them.
That is very interesting. We shall see. It also could be a theory just to make menopausal women feel a little bit better about the stage they're going through, but I'm buying in.
Yeah, I love it. I think another thing I found when I was researching it is that elephants will go through sort of like menopause, but they die very soon after. So they don't actually live much past their reproductive window. And that's kind of what seems to happen with some other mammals. So I think it's really interesting that certain of us just developed a certain way so we could maybe teach our posterity. And I think that's really neat.
Yeah, agree.
All right. So here is our last question of the day. I think this one is just one that we hear all the time in our field. And the title of the question is, "My husband is no longer attracted to me." My 46 female husband, 46 male, and I are happily married. Early on, we had the usual ups and downs, but after 20 plus years, we are in a good place. He shared in the past a desire for me to maintain a specific physique, and right now I'm about 30 pounds overweight. I've dieted for many years and have fluctuated up and down 40 pounds since having children. But in the last couple of years, I've struggled to shed the last 20 to 30 pounds. While we have a pretty robust sex life, 2 years ago, my husband confessed that he just doesn't find me physically attractive with the extra weight and fantasizes about being with someone with a better physique. I was extremely hurt, but I poured my energy into working out more, getting a personal trainer, and starting with a medical weight loss clinic. I'm perimenopausal and had surgery around the same time he told me this, so I think there may be hormonal issues limiting my progress. Despite my efforts, there's little change, and my husband keeps making subtle hints about fasting or other weight loss strategies.
Oh boy, if I had $1 every time a patient of mine came in and complained of this issue, I'd be a wealthy woman. So, first, thank you for bringing this to our attention, because I think that most likely everybody reading this post or hearing this video is going to have some sort of connection to this story. Most importantly, you need to feel best about yourself. Regardless of what your husband is saying to you, it really is more about how you feel. I really applaud you for taking such control with a weight loss clinic and exercise, recognizing that weight loss may be harder during perimenopausal time. And some of that is not due to your willpower, but just due to physiologic changes. So let's talk about what can be done, because it seems like you personally and most women would feel better if they're more toned and can be at the weight that they feel comfortable at. Number one, I always recommend a Mediterranean style of eating. This is not a quick fix diet, but rather more of a lifestyle. It's low glycemic, so we don't have big dips and raises of glucose, and steady insulin levels are helpful for the metabolic syndrome prevention. Number two, it's a heart-healthy diet because it minimizes salt, so less chance of high blood pressure and other cardiovascular issues. Number three, it really focuses on whole foods, whole grains, so we try to eliminate ultra-processed foods. It also recommends olive oil instead of butter, for example, which again is a heart-healthy thing. The point of my making all this very detailed is that the Mediterranean style diet will not only help with weight, it will help with energy, and it will help with longevity in the long run. Number two would be the type of exercise you're doing. And if you're working with a trainer, I'm sure this is already being suggested. Cardio is great. We recommend 150 minutes of cardio every week for burning calories and doing something that you enjoy. But weight training, resistance training, flexibility work, balance work, this also has to be done to build muscle, which enhances metabolism. It also will help with toning. But what happens with age, and therefore with perimenopause and menopause, is that we lose muscle. And that translates to a lower metabolism. So you're fighting such an uphill battle if you don't add some weight training. This also helps with bone strength, which diminishes with time. Number 3 would be stress reduction, whether it's with exercise, meditation, one of the Eastern practices, whatever works, yoga, Pilates, because stress causes the release of cortisol from the adrenal glands constantly. And what does that do? It puts weight right around the middle, this visceral fat. It is so tough, and it is so tough to lose that. And it's not only occurring externally, but it's also occurring around our organs on the inside. So this really needs to be addressed. Third, talk to your doctor about whether there might be a medical issue going on that's making loss of weight or maintenance of weight more difficult. For example, checking your thyroid, checking your sugars. These things could be helpful. I think that those are really good places to start. There is such a rage with weight loss medications right now, so that also could potentially be an option if you really feel like you need extra assistance. But I think it might also be helpful to have a direct conversation with your husband, because these statements may be being made with loving kindness because your husband may know that you want to also manage your weight, but he may not even realize that they're hurtful in some ways. So direct communication could be helpful here.
Definitely. I think sometimes, men can talk to each other about weight like it's nothing, but for women, it's really like a deeply kind of hurtful topic. And it's really frustrating when you have other factors working against you, especially in this stage of life when everything seems to be changing. So I think that's really good advice to have like a conversation, because he may well not even know that he's being hurtful. So
some men think that that's an encouraging way to have a conversation. So.
And, my mom is 56 and she just started Pilates. And I know you mentioned that. I love Pilates. I go 3 times a week and I love it. And I have, back and some joint problems, and it's really, really helped me. And my mom has been loving Pilates. So if that's something that you recommend, then she'll be happy to hear that.
Absolutely. I think what's most important is to do something that you actually enjoy or you like the class or the people who are in it, because then you will continue with it. Nothing worse than trying to get into an activity that's just not enjoyable for you.
Right.
So keep in mind, this is also very helpful in future for mobility, for flexibility, for balance, for bone health, for prevention of osteoporosis. So it is never too late to start with these lifestyle habits.
All right. Those are all the questions that I have for today. Thank you so much, Dr. Dweck.
Oh, you're so welcome. I really feel like these questions just resonate with me so much as a gynecologist, because sometimes I think half of us are half psychiatry, half gynecology, and a lot of this has such an emotional undertone. So thanks for bringing them up.
Of course. Well, this was a great conversation, and we will see you guys in the next episode. Bye.